Namaste and good evening. I, Chabi Jain, researcher at IMPRI, Impact and Policy Research Institute, Prabhav Evam Niti Anusandhan Sansthan, Nai Delhi, extend my warmest welcome to you all to IMPRI #Web Policy Talk. Today, we have gathered here for a panel discussion on Gender and Union Budget 2022-23. This discussion is a part of the series #Gender Gaps, organized by IMPRI, Gender Impact Studies Center. The chairpersons for today's session are Professor Vibhuti Patel, visiting professor at IMPRI and former professor at Tata Institute of Social Sciences, Mumbai, and Mr. Ravi Duggal, independent sociologist, public health researcher, and activist. Welcome, ma'am and sir. With the permission of our chairpersons, I would now like to introduce our panelists for today. Ma'am, you're muted.
Please go ahead and introduce the panelists.
We are privileged to be joined this evening by our esteemed panelists, Professor N. Manimekalai, Professor, Director, and Head at Department of Women's Studies, Bharathidasan University, Tamil Nadu. Dr. Seema Kulkarni, Founding Member at Society for Promoting Participative Ecosystem Management, Pune, and Member of National Facilitation Team, Mahila, Kisan, Adhikar, Manch. Dr. Sanghamitra Dhar, Technical Coordinator, Gender Responsive Budgeting, UN Women. Ms. Renu Khanna, Trustee at Sehaj, Vadodara, and Member of Feminist Policy Collective. And Ms. Jashodhara Das Gupta, Co-Convener at Feminist Policy Collective. A very warm welcome to all our esteemed panelists. Now, I invite our chairpersons, Professor Vibhuti Patel and Mr. Ravi Duggal, to proceed with the deliberation. We look forward to learning from our esteemed gathering.
So first of all, we would like to offer heartfelt thanks to Dr. Arjun Kumar, Dr. Simi Mehta, Anshula Chavi, and the whole IMPRI team for taking initiative for this important but much neglected theme by the mainstream media. It's a pleasure to co-chair this panel discussion with Shri Ravi Duggal, who will contextualize the gender concerns in the union budget in an overall macroeconomic scenario. And I'll broadly highlight the thematic areas of inquiry through this panel discussion, in which veteran feminists, conscience keepers of gender responsiveness in allocation of funds, functions, and functionaries in the government expenditure, they are with us. Their sensitivity towards intersectional gender marginalities will be quite educative. So I greet Dr. Jashodhara Das Gupta, Ms. Renu Khanna, Dr. Seema Kulkarni, Dr. Professor Manimekalai, and Dr. Sanghamitra Dhar for this. And now, Ravi, please take over.
Yeah, thanks, Vibhuti, and welcome to all the panelists. Warm greetings. Let's take this process forward to understand the gender budget context in the current union budget. To begin with, what I plan to do is to just give a macro perspective of the 22-23 budget from where it comes. And then we will get on to looking at the gender dimensions of the budget and what the gender budget statement tells us. Where the panelists, I will ask certain questions to the panelists, and so they can respond to that, but they'll be free to add other things they think are important from their context of their understanding of the budget. I think firstly, what I would broadly like to say that this budget is very capital oriented. It is, it's like a movement from labor to capital as the centrality of the budget, because we see a lot of cuts in welfare programs, which includes food subsidy, other subsidies, fuel subsidies for LPG, etc. Huge cuts, and also for programs like health and other welfare programs of social security. which is evident. It's in the overall budget, but also if you look at the gender budget statement, there also you see similar cuts that have happened. And this money, which has been cut from the welfare fund, which basically is a labor-intensive kind of thing, has moved to capital. We see a huge increase in capital expenditure in this budget. So if you match the cut at the welfare end with the increase in the capital expenditure, you see a similar amount of something like 1.75 lakh crores, which in a sense has been moved in favor of, and that capex expenditure is going to help nobody else than the private sector growth. That is where it will be directed. All those infrastructure projects of highways and things, they are important, but I think you cannot do them at the cost of cuts in the social sector. So that is very evident. And as we know that social sectors do affect women much more than otherwise, but than the general population, because they include sectors like health, education, and many other welfare programs, including domestic violence related programs, and so on, the Nirbhaya Fund, etc. So all these have seen either cuts or they have been reduced in terms of the share of the budget. So just to give you an idea of what has happened, it is, if you look at social services as a whole, it has changed from 5.89% of the budget to 5.42%. That's the change that you see from the previous year. Health has changed from 2.33% to 2.25%. This is of the total government budget. Food subsidy, a huge cut from 7.93% to 5.24%. And I'm taking the revised estimate and not the budgeted thing, which was much higher. Then similarly, rural development, again, a huge cut, largely in the rural employment program, NREGA, which a lot of women are dependent on. That has been cut from 5.58% to 3.42% of the budget, the share. Rural employment, even worse, 3.16% to 1.85%. And overall subsidies, which are fuel, fertilizer, and food subsidy, from 21.6% to only 8.99%. So this is what has happened with the social, what we broadly call the social sector, which includes social services, rural development, and food subsidy as per the RBI classification. So this is what has happened to this budget, which of course impacts gender ultimately, and our panelists will provide us that evidence. And if you look at the gender budget, it is flat. I mean, it has stayed around 4.3% of the total budget, so not much significant increase. It's remained flat over the last 3 or 4 years at 4.33%. And the bulk of the gender budget is accounted for by 4 or 5 programs. That's health, education, NREGA, and WCD. And again, we see as a proportion to the respective budgets, it has the gender budget is also more or less flat. In health, it has declined. In others, it has remained flat. So this is the kind of overall kind of thing that we see in this budget. And on the income side, it is very clear that this government is not putting enough efforts to collect adequate taxes. Our tax GDP ratio remains at 10%, but it can actually be doubled if all uncollected taxes are collected in a timely manner, because our uncollected taxes are 89% of the total taxes or of total revenues. So this is a huge amount of tax which is lying, which was raised but has not been realized. This is what the government calls it. And further, revenues foregone also are as high as 4.7 lakh crores, mostly corporate revenues foregone. This is what is the subsidy which goes to the corporate sector, which is not accounted for as subsidy. But if it goes to farmers, they talk of subsidy. So so this is the kind of overall picture that we see of this budget. It is definitely not friendly to the poor or even the middle classes, and certainly not to women and elderly and the disabled and all other vulnerable groups, the scheduled caste, scheduled tribes. So everywhere we see major cuts or reduction in shares of each of these sectors vis-a-vis the total budget. So let's move on to our panelists, and we will begin with Sanghamitra Dhar. She's from the UN, and she specifically works on gender budget issues across states. And I would request her to kind of focus on these 2 or 3 questions. The first is, Sanghamitra, what is your overall sense of the gender budget which has been presented? I mean, in the overarching thing. And second, your take on the methodology of gender budgeting and how it can be improved based on your experience working in different states, because there is variation across states. Some of the southern states like Kerala and Karnataka have had much better structured gender budgets. So looking at that, and then finally, any specific concerns and suggestions you have to improve gender budgeting and understanding gender budgets. So, okay. Sanghamitra.
Thank you, Mr. Duggal. And first of all, hello everyone, and thank you for having me here. I would first of all like to thank the IMPRI team and all the organizers for this interesting discussion. And also, I would like to acknowledge that I am in the August panel composition of people I actually look up to in this subject area. So I'm really very happy to be in this group. So thank you, Vibhuti ji, for this invitation. When the topic was shared with me, the first thought that came to me somehow was the famous quote by Shelley Chisholm, who had said that if they don't give you a seat at the table, bring a folding chair. So we know we live in a capitalistic patriarchal society, and the conversation around gender budget, when it began some decades back, must have been like bringing the folding chair around the gender, around the center of the discussion strategically and with conviction. So for that, I thank my feminist predecessors for that courage and girth. So because of whom we are today somewhat in a fixed kind of chair on the table, because gender lens on budget is a work in progress, and lot is to be yet achieved, and a lot of work is needed around equity and equality in the budgets. So coming quickly, one aspect that I very strongly believe needs to be kept in mind is that when we are talking about gender budgeting and planning around building or rather preparation of building the gender plans and submitting the gender budgets in part A, part B is a very technical task that each department or ministry officials are required to work upon. And from my personal experience, the capacity building around it is a major requirement and is being addressed across, of course. And as Duggalji has pointed out, South, some of the states in South is performing well. Currently, there are many other states also who are doing very good work. So I am hand-holding one of the states in northeastern India. It is called Manipur, and they are doing exceptionally well. So we are looking forward to a very good sustainable model. So, but coming to your query, Duggalji, I would, at first glance, I would say through the gender equality, equity perspective, this union budget to me looks encouraging and forward-looking, because the Amrit Kal reflects a futuristic and inclusive tenet with women-led development at its core. So the aspiration for achieving the SDGs look promising, whereby the policy trinity of efficiency, equity, and sustainability is emphatically drawn upon. So be it the strengthening of the digital economy, or focusing on the remote northeastern regions through different programs of infrastructure and all, or the water pump at each house that specifies that it will be trying to cover 3.8 crore households, directly impacts women, or even the increased allocation of safe city projects, national health mission, national education mission, or overall revamping of the MWCD schemes for women and children do look like adding a momentum to the women-led development perspective. But again, as a first glance, it looks rosy, but more detailed study of the same does give us some areas of concern and reconsideration. And as Mr. Duggal rightly very briefly pointed out some of the lacunas, I would just also want to remind all of us, and because we are coming out of, or rather we are trying to recover from a pandemic that has caused unprecedented loss of life as well as the economy. So the need of the hour is obviously therefore to address holistic development that not only focuses on income growth or investment or fiscal growth, but also devotes exponentially on well-being and growth in human through quality health services and quality educational services. And I find the mention of mental health services as an extremely important component in this budget speech. One of my area of concerns, among many others, is on the emphasis of the digitalization of formal education system in order to address the dropout issue, because as you know, the girls' dropout rate is highest. It was bad pre-COVID also, and now it has kind of exacerbated. So to address it, they are trying to, the intent is to digitalize further. But I was wondering, without addressing the access and quality of resources, such as the plain and simple electricity supply in the rural areas, or the internet connectivity, or the availability of even the devices, this will be hard to achieve. One of the critical aspects that I understand also, as Mr. Duggal has also pointed out, is the restructuring of the funds is somewhere associated with the utilization of the funds also, because once it is not utilized recurring, it actually gets, the allocation gets shifted. So in that sense, we have to be very mindful that when we are talking about building back better, we have to ensure that the promotion of more equal India through the distributive justice system needs to be kept in mind, and how that social and economic disparities are being looked upon will be very, very critical. And one of the, as I earlier also mentioned, that one of the key elements of the gender budgeting mechanism overall is that the officials that are part of the discussion need extensive capacity building, because many a times their intention is very good to work on how this can be made more women centric or gender friendly. However, they don't know how to allocate, how to assign it. So our part of handholding them to work around it becomes all the more important. And I'll just start with a small example where in this current state itself, when the previous, because Manipur has submitted the first GBS last year. So it is in the process of building the second one. So in the previous one, because that was the first year they were working on it, some of the ideas for people who have been working in this area sounded, we know this kind of a thing. But for them, because this was the first discussion they were having on how to look at a budget through a gender lens, so some of the ideas that they gave were very interesting and very heartfelt. So, for instance, they talked about building toilets around these infrastructure, longitudinal infrastructure projects, as in the highways and roadways, where women do not, there are no toilets around it. And can it be built around? Can that be part of the conversation? Was one of the queries for transport department. I'm just sharing an example because we have been handholding per department. So in those conversations, the intent seems very genuine, though the capacities around how to work around it is very limited. So what as a person who's working to help this sector, I feel that we have to kind of be always on our toes to whenever there are a query, because now they are building the demand of grants, the process is ongoing. So wherever they have queries, we are always ready to respond to it and try to help them on building it. So that is a process that needs to be acknowledged when we are talking about gender budget, because the overall plan, the overall allocations are affected by this. Because if the official who has to work around it is not aware of it, and enough capacities are not built on it, then no matter how much the feminist group or the learned section tries to pitch for these ideas, it will not it will not show on the papers because they don't know how to do it. So as simple as kaise karna hai needs to be worked around, and that is something UN Women has been working on. So I'll pass it on to the next panelist. I hope I have answered Duggalji's queries, and I'll come back to rest if there is another. Thank you.
Thanks, Sanghamitra ji. I think you have raised important issues and concerns, and so I think mainly you said that at least on paper, you can see some women-led development happening, or digitization being an important tool in the process. But I think what is there on ground zero is something that we need to be aware of, and we don't. Let's hope in the near future we don't have to carry a folding chair, and it becomes gender equity becomes center stage in the budgeting process. So with that, we move to Jashodhara is next. Yeah. So Jashodhara, for you also, I have something similar question, but since you have been working with the women's rights issues and social policies broadly, what I would like you to kind of enlighten us on is, from the women's perspective, how are social policies being kind of translated into budgetary commitments? To what extent the gender budget reflects this? I mean, in terms of how well this is done, and specifically, how does gender-based violence get reflected in the budget, and specifically within the gender budget statement? Because we have seen that in this year's budget, I mean, they've messed up with the WCD allocations. I mean, the separate programs which are there, they've been put under umbrella programs, and we can't. It becomes very difficult to trace them in the budget. So that was a major challenge when I was going through the WCD budget, and any other specific concerns that you may want to highlight or suggestions. So over to you, Jashodhara.
Thank you very much, Ravi, and thanks the team at IMPRI, Vibhuti, and also Ravi for having me on this panel. I'd just like to share screen, if you don't mind. So I'm putting on the slides.
Ma'am, I'm also ready with it. Okay,
Okay,
it's
yeah,
fine.
I'll share it here. Is it, if it's visible?
It's
Is it
visible, ma'am.
Okay.
You can go
Yeah.
full screen.
Okay, thank you very much. So I'd just like to give an example of what Ravi asked for through two sectors. One is looking at nutrition and the other is looking at social protection and social policy. And I just want to mention that I'm here on behalf of the Feminist Policy Collective. There are other colleagues here, and I'm really representing some of the joint analyses we've come up with as a result of our pre-budget consultation. So just to say that in terms of food, while we are a middle-income country, it's remarkable how much hunger there is across the country. And of course, we all know that there has been widespread loss of jobs and employment, especially through the COVID, but even earlier. We also have an idea about how many people may be left out because the system for ration cards under the NFSA has not been updated in the last 10 years or so. And we estimate about 90 million people may actually be out of that safety net just because most of them don't have the proper documentation. And right now we were hearing Sanghamitra speak about how the digital sort of pressure for documentation is actually excluding large numbers of vulnerable people. And then finally, I think the clinching evidence has been the NFHS 5, which has shown how women are impacted by this absolute neglect of food security and nutrition, because we find shockingly that over the last 5 or 6 years, levels of anemia have gone up among all categories of women. And this is really shocking because anemia is separate from either obesity or thinness. It really talks about the nutritional status of women. And this is really dangerous that pregnant women, more than half of them are anemic. A very large proportion, almost 2/3 of non-pregnant women and adolescent girls, which is all higher than the last measurement in NFHS 4. And also the fact that women with low body mass index has just gone a little bit lower, in the sense it was earlier 23% and is now 19%, but that is really nothing to celebrate. So given this status, given the kind of hunger that we are looking at, what are we seeing in the budgets for food security and nutrition? So while we see a food subsidy allocation of 2.06 lakh crore, while we see schemes for supplementary nutrition and maternity allowance, actually what is happening is these very essential schemes have been reduced from the last budget if we adjust for the 5% annual inflation. So these amounts are actually highly insufficient, also because, as Ravi just flagged, these schemes like the Saksham Anganwadi, the Samarthya scheme, etc., they're actually combinations of 4 or 5 or even 6 schemes put together under one budget head. Now, while this may be useful in kind of administrative terms, in terms of accountability and outcomes, it's very difficult because you do not have separate allocations. You're not sure where the priorities are shifting. And for instance, the Anganwadi workers have really been complaining about the pressure for them to use digital ways of reporting when the condition of the physical Anganwadi building is absolutely abysmal. We also find shockingly, given the status of adolescent nutrition, that the allocation for midday meals has been reduced while giving it a shiny new name. Cooking fuel is something that is not only essential for food security, but also contributes to women's burden of household labor. And we find that the subsidies have been slashed. This is very ironic coming after what Ravi said about the kind of freebies and tax exemptions and subsidies being given to the corporate sector, that the budget for LPG to be allocated to poor households has actually been halved, which is quite shocking. And also the direct beneficiary transfer has been reduced to 1/3. The small relief that people had received from the Pradhan Mantri Garib Kalyan Anna Yojana, unfortunately, has not been extended beyond this March. There is no allocation for this extra relief that people had received during the crisis of the pandemic. Let's look at social security as an example. I would call it social insecurity, because right now India's Human Development Index is really, really low down. And on the other hand, we find that India's spending is seen as among the lowest at 1.4% on social protection, which is actually far lower than many other low to middle income countries, normally which are spending about 2.5% of their GDP. The Oxfam report that came out in January was quite shocking, because it reported that 84% households had actually lost jobs and had severely reduced livelihood incomes. And then the inequity of it, of course, was that 142 billionaires became way, way richer during the pandemic. PLFS data has shown that more than 2/3 of the people who are earning in this country are actually earning barely 12,000 per month. So given this absolutely, precarious state of social protection, what do we find in terms of the policies for social security? So one of the ironies is that although 95% working women are in the informal and unorganized sector, or are self-employed, or work on family farms or family enterprises, all the laws and policies for social protection in this country are employment-based. Laws which were meant for the protection of labor are now being undercut through the labor codes, which have been widely protested by the trade unions. We also find that where there are specific sector-wise labor boards, for instance, the Building and Construction Workers Labor Board, Welfare Board, we find that women who constitute a very large section of the workers under this sector are mostly unregistered because they don't have continuous employment. Many of them are seasonal workers. In terms of the pensions that are available, the budgets are abysmal for the union government, which is actually coming to a contribution of about 200 rupees per month per pensioner. And as we found during the COVID, that the pensioners were given for 3 months an additional allowance of 1,000 rupees. And we all know how much that can fetch in today's market rates and the very serious inflation that's going on. So in this scenario, how do we engender budgets for nutrition and social protection? I think if we were to take a really gendered perspective, one of the first things would be to look at how we universalize the public distribution system and include the vulnerable population who don't have ration cards, which include the migrants, the homeless, trans persons, sex workers, and many other destitute people that are across the country. The other thing, given the state of anemia, is it's very important to provide millets and proteins as well as oils within the PDS, and to ensure that there are community kitchens which can feed the hungry and the migrant workers who are most vulnerable and do not have ration cards. The ICDS system really needs to come back because it has led to a huge gap during the pandemic. And we know that the take-home rations have not really been sufficient in terms of providing the nutrition needed for women and children. It's important to ensure that there is a protein-rich food that is provided for children, adolescents, pregnant and lactating women. If women are to come back to the workforce and enhance family incomes, creches are essential. And therefore, the budgets for Anganwadis need to be hugely increased in order to turn them into Anganwadi cum creches and provide 8 hours of childcare for women. A long-standing demand has been the workers for ICDS, midday meal, and other helpers and so on have not been receiving minimum wages.
1 more minute.
Do not have decent working conditions. And this has been a struggle, and we feel that has to be a part of a gendered perspective looking at their care work. Finally, I'd want to mention maternity protection, which needs a ratio of 40% from the union and a minimum outlay of 8,000 crores. And we must stop conditionalities because contraception was not available for women for the last 2 years. Pensions cannot be at the ridiculous figure of 200. They need to be enhanced to at least 2,000, and we must ensure transgender persons also get it. And we have to go beyond digital methods in order to register women workers within the labor welfare boards and utilize the funds available. Thank you very much. I look forward to the rest of the discussion.
Thanks, Jashodhara, for these very insightful an evidence-based presentation, as well as your suggestions for especially related to nutrition of women and the programs related to that. And I think what is important is that universalization is absolutely necessary. And linked to that, I mean, when you have programs, whether it's the maternity benefit program or other benefits being provided through different programs, you need to benchmark budgets. And if you know that so many women are going to be delivering babies in the coming year, then if it is at the rate of 6,000 rupees per maternity case, then that is what needs to be budgeted. And we know that 2 crore women deliver every year. So that kind of budgeting becomes very important and critical if it has to have any impact. So thanks again. And Renu, now we move to you. And for you, similar questions. So how are social sectors like health and education and welfare placed with the gender context and budgetary commitment to that? I mean, so how are they placed within the gender context, especially these social sectors? And your suggestions as to how the gender budget needs to be structured to generate a robust robust understanding of gender differentials that we see. I mean, Jashodhara has already kind of pointed out the NFHS 5 the differentials in anemia and across genders. So how do we deal with that, and any other specific concerns that you want to highlight? Thanks.
Thank you. Thank you very much, Ravi. And thank you to IMPRI and all of you for this opportunity to engage with this budget from a feminist perspective. Would you, or should I share my screen? 1 minute.
I'm doing it.
Okay, okay. All right. So, so I'm going to be looking at the health budget from a gender perspective. And can we have the next slide? I think many of the, there's an overall critique, and I feel that year after year, we make the same critique of the health budget. The first point is that health as a percentage of the total budget of India, of this country, is only 2.26% in this period where we are, dealing with COVID. And to me, it seems that that's a big lacuna. Health expenditure of the total expenditure is just 2.46%. The government of India expenditure on health is a percentage of GDP. WHO recommends 5%, suggests 5%. The National Health Policy promised 2.5% by 2025. But in India, we have a very, very small percentage of our GDP going to health. And that is quite distressing. And this has been continuing for many years. I mean, it's not just despite all these promises. The National Health Mission budget has been decreasing. And Ravi's own analysis showed that from 58% in 2018 to 48% in 2023 budget estimates. And as I was saying, all of this is in the COVID context when we should have seen a dramatic increase in the health budget in this country. Next slide, please. Yeah, so the ground realities. I mean, I think that this budget, as Ravi was mentioning, and as Jashodhara's also spoken, it's a very, very capital-oriented and infrastructure-oriented sort of a budget. There are huge shortfalls in human resources. against WHO standards, where we state that for every 1,000 population, there should be one doctor. India has 972 persons per government doctor. And in states, if you look at the state disparities, every state there's no state in the country which matches to this WHO standard. And the rural health statistics also tell us from a women's health perspective, the shortfall of obstetricians and gynecologists in the country to the extent of 75%. And shortfalls in health infrastructure. WHO standards again are saying that for every 1,000 population, there should be 5 beds. In India has, as you can see, 1,000 and almost 700 persons for one hospital bed. And again, the state differentials, state inequities can be seen. So these are the ground realities in which all of this, the digital mission and all of that is proposed. And it's very, very, it's anachronistic, I feel, to some extent. Next slide, please. So the NHM expenditures have been low, which is, the utilization problem that we have just spoken about. These highlight that. And this also reflects the situation on the ground. We saw that in the 2 years, 1920, 2021, there was a reduction of routine services as we were coping with COVID. There's an absolute standstill of, although women's reproductive cycles continue, the services are not there. And these reflected in all of these statistics that we can see. 43% decline in institutional births, 46% decline in cesarean sections. Now, on the one hand, that can be good to prevent unnecessary cesareans, but for women who need those cesareans, it is a denial of an essential service. A 53% decline in eclampsia, high-risk pregnancies. Jashodhra spoke about anemia, severe anemia, which leads to maternal mortality through hemorrhage. So all of these things, people not being able to access contraception, which led to unwanted pregnancies, which may then lead to unsafe abortions, which again lead to preventable maternal deaths. So all of this has been seen, and not just in the first wave, also in the second wave. I think the second wave also, we were not prepared to deal with all of this. Can we go to the next slide? So this is the larger context. This is the background. And so how do we look at this health budget from a gender perspective? And I want to say that the devil is in the details. What Ravi was saying just now about how do we go about our budgeting exercise. We have to look at what the needs are on the ground. We have to look at what the situation is on the ground. And we have to provide financial resources based on, what exists on the ground and planning based on that. And I feel that that bit is actually missing. There is allocation done, and then you'll see how that allocation will be, sort of spread across various issues. Let's go to the next slide. And so here, I just want to state what I feel are the issues in gender and health. Firstly, lack of access to healthcare and determinants of health for women, for girls, for, the sexually diverse people, and also looking at socially disadvantaged groups like Dalits, tribals, and minority groups. Affordability is definitely an issue. There's so much of commodification of women's health through the, over sort of powering private sector. Quality of care leaves much to be desired. And a stark example of this is the obstetric violence, which is universal within institutions. unnecessary medicalization on one hand and lack of primary gynec care on the other hand, and the role of private sector, as I just mentioned in all of this, health human resources, the role of frontline health workers, their protection, their working conditions. All of these are very, very important issues when we're looking at health from a gender perspective. Let's go to the next slide. So, I divide this into two categories. One is the sex or the gender specific issues, access to contraception, maternal health services, reproductive sexual health services, adolescent health. For the transgenders, I think there is a sex reassignment surgery. There's all the hormonal preparation treatment, which is required before and after. All of that would be issues from a gender perspective, which fall into the health domain, and a gender perspective in all healthcare provisioning, which requires gender analysis and differential programming. And I've just given one example over here. So all of this has to be factored in when you're talking about health budgets from a gender perspective. Let's move to the next slide. So this budget, all of us have spoken about the Ayushman Bharat Digital Mission. We've also spoken about the mental health program, which is being expanded. And on the one hand, I think that the mental health program is absolutely required, especially in this COVID period when there has been so much stress and anxiety. But again, raising the same question that you have raised, how do we factor in the gender gap in digital inclusion? And we saw this very, very clearly when it came to vaccines, and women's access to the co-win portal was much lower than it was for men. This Nari Shakti for Amrit Kal, these are the slogans which this budget has used. The Saksham Anganwadis, and they're talking about a new generation of Anganwadis. I think that's an excellent thing. You need better infrastructure. Okay. So you need all of this, but what about increasing the duration? And Jashodra spoke about creches for working women. What about better food and nutrition, better quality of care? There's also talk about increase in the health and wellness centers. And this is an excellent move from the perspective of primary sexual and reproductive health care for women. But the details of the training and skilling of mid-level providers needs to be ensured. Decline in this Sambal scheme, which would cater to protection of women, gender-based violence, violence against women, that is something which is of concern. Next slide, please. So PMJY and insurance schemes, we've already spoken about how these have actually not delivered during the lockdown period. There is also critique of insurance schemes from a gender perspective. I won't go into all of that now. Let's go to the next slide. So, the allocations for PMJY have to be questioned and have to be sort of made more gender sensitive. I was looking at this document of the major schemes and trying to make sense out of them. And this Pradhan Mantri Ayushman Bharat and Health Infrastructure Mission, you see this in various places, various account heads, and I actually begin to question what each one of them contains. Saksham, as we were saying, the adolescent girls program, there's only 1.3% increase in this. Let's go to the next slide. I'm now moving towards my recommendations. So the first generic recommendation that we keep making year after year is that we need to substantively increase our expenditure on health. And so budgets as well as expenditures have to be increased. We have to prioritize spending on strengthening and expanding public health services, the health and wellness centers, but also include well-trained, competent staff. We also need male health workers, which is something which is not really focused upon. It's only the women frontline workers. And with our boys and adolescent boys population, I think, and sexual and reproductive health issues, male health workers would play a very key role. The health and wellness centers need to include an SRHR package. The Rashtriya Kishore Swasthya Karyakram, we talk about our adolescent population and say that they are our demographic dividend. But what are we doing to ensure that we have healthy young people? And so budgetary allocations for these programs need to increase. The health and nutrition programs need to increase. And not just the investment, but also the tracking of health outcomes has to be focused upon. Budget allocations for violence against women and gender-based violence as a health issue has to be made adequate. Next slide, please. And this is my last slide. We need to guarantee free medicines, including blood. Blood is an essential commodity as far as maternal health is concerned, or health in emergencies and trauma is concerned. Diagnostics, cancer screening, double the expenditure on our 7 million frontline workers, regularize ASHAs as permanent staff with fixed salaries, increase social security and protection for all frontline staff, invest in developing gender transformative health programs, non-communicable diseases, communicable diseases with regular monitoring, including community monitoring and external audits, universal health coverage through social health insurance, and expansion of ESIS to cover informal sector, and with awareness and integration of gender sensitivity. And as we saw in the COVID crisis, and also this is a chronic problem that we have, our data systems are not transparent, are not accurate. We need to strengthen systems for accurate data on deaths, including age, sex, comorbidities, and disaggregated data for better planning and an appropriate health system response. Thank you very much, Ravi. I'm sorry if I overshot my time.
Yeah, thanks for doing a great analysis of the health budget from a gender perspective, and for your very useful suggestions. So, Vibhuti, over to you to take this forward.
I'm on mute.
Unmute yourself.
Yeah, we had a very rich evidence-based discussion on important areas of health education, gender-based violence, and schemes for the women empowerment, and also the workers who are working in the government-sponsored mega flagship schemes. So over last 3 days, gender economists and women's rights activists have been debating this highly masculine budget that has completely overlooked the main gender concerns, basically the widening gender gap in the health, well-being, nutrition, education, employment, deplorable condition of health workers such as Anganwadi workers, sanitation workers, ASHA workers, self-employed women in nano and micro enterprises, and pandemic-triggered gender-based violence, trafficking of gender girls and women, forced child marriages due to impoverishment, and more than 1 crore girls who are forced out of school system due to digital divide, and also forced child labor. By and large, the mainstream media has bypassed critical reflection on gender responsiveness of Union Budget 2022-23. Economic Times has used pictures of women along with articles that has nothing to do with women, except for Hindu. No mainstream daily has analyzed Union Budget with gender lens, and it has followed the policy of women are to be seen, not to be heard. So the state has abandoned its responsibility of translating gender commitments into financial commitments in situation where 2 years of pandemic have eroded even the pre-pandemic gains of women, girls, transgender communities, persons with disabilities, and other impoverished communities. 92% of the workforce is languishing in the informal sector. So while the gender budget is increased in absolute term, but it has shrunk in terms of percentage. I don't want to do number crunching. Lot has been covered in terms of the allocation. So, but the part A of gender budgeting, which talks about the schemes for the rural and urban areas. So 2 schemes for rural development, Pradhan Mantri Awas Yojana or Indira Gandhi National Widow Pension Scheme, because now there is a new term called COVID widows. And even the allocation for women protection schemes under One Stop Center or Mahila police volunteers, women helpline, Swadhar, Ujjwala, widows home, they have seen decline. So that from the earlier budget, so from 587 crore in the previous budget to 560 crore. Part A, like in Samarth scheme, where Beti Bachao, Beti Padhao, and Pradhan Mantri Matru Vandana Yojana, also we have seen it has more or less stagnated. Sambal and Samarth together constitute umbrella scheme of Mission Shakti. There too we don't see much, it's a marginal increase of 100 crore that we see. In Part B also, which covers where the 30% of allocation is for women, which includes schemes with a significant focus on women, basically MG Narega and PDS. And I think Jashodra's analysis showed that how there also women, there is not much increase. 2 urban schemes, Pradhan Mantri Awas Yojana and Deen Dayal Antyodaya Yojana, National Urban Livelihood Mission. In there also we see there are not much increase. And in rural schemes, Ministry of Rural Development's National Rural Livelihood Mission and Mahatma Gandhi National Rural Employment Guarantee Scheme, there has been decline. Women are the large number of beneficiaries of this flagship schemes like MG Narega, National Social Assistance Program, schemes for welfare of SC, ST, minorities and other vulnerable sections. But the combined expenditure on these schemes has reduced from 3.2% of the revised expenditure 21-22 to 2.5% budget allocation. So budget ensures like tariff protection to the capital goods, but it is silent about what kind of support it will provide to women entrepreneurs, 95% of whom are in the nano enterprise or the micro enterprise. So it is in this context that I would like to ask Dr. Seema Kulkarni first about the rural sector, that what has been the impact of union budget on the farm sector, and does the budget respond to the demands of women farmers and your organization, which has articulated the needs, demands of women farmers? Dr. Seema Kulkarni.
Yeah, thank you, Vibhuti. First of all, I'm not a doctor, so I think that correction is definitely due. But thank you very much for inviting me here, and thanks to IMPRI as well. I think the discussion has been extremely engaging so far. Ravi has actually laid out the context of the budget, the macro context extremely well. So I think that already sort of helps me in trying to locate the agriculture and allied activities and how we need to understand that from a feminist perspective. So I think the initial comments made by Ravi, which clearly sort of indicate that the entire thrust of the budget, which is extremely important to understand, is driving towards privatization very, very clearly. And I think here it's a huge infrastructure heavy budget, with the different components that have been included under Gati Shakti, where I think the entire allocations that we see in terms of infrastructure, in terms of productivity enhancement, really need to be critically looked at. So I think this entire characterization of the budget and the Amrit Kal that the finance minister spoke of definitely mirrors the at 100 vision that the Prime Minister spoke about in the Independence Day and Republic Day celebrations. Coming to agriculture, I think we've already looked at the allocations in the gender budget, the overall allocation that we see, which hasn't really increased substantially. We only see some of the total expenditure. But if we look at the agriculture gender in the gender budget, we see that the allocation, the total allocation is a mere 1.5 to 1.6%. Now, this is actually the part A of the gender budget, has a very small allocation, which is only for institutions which are for women. But how much of emphasis there is in terms of understanding issues and concerns of women in agriculture is certainly part of an outcome analysis, which very often we do not see. It's the part B of the gender budget where, which is the 30% category, where we see some allocations in agriculture, but as I said, it is extremely low. And what is very intriguing here is that a major section of the budget that was dedicated to, let's say, rain-fed area development or Paramparagat Krishi Vikas Yojana. Now, these are also schemes where, more specifically, if you're looking at rain-fed area development, this is where a large percentage of our smallholders really reside. So, this is the budgetary allocation that we were most looking forward to. But in the entire agricultural budget, what we are now seeing is that the Rashtriya Kisan Vikas Yojana has been restructured. And just as Ravi mentioned in the WCD, where there has been a clubbing together of a number of schemes, the RKVY allocation, although it does see an increase, but the restructuring does not allow us to really understand the separate allocations for its different components. For example, the rain-fed area development program or agricultural mechanization, all of these programs are merged into the RKVY. So that is a significant area of concern. And none of these schemes or even sub-schemes are actually reflected in the gender budget. So now, in terms of agriculture, I mean, even in terms of absolute budget, what we see in the gender budget statement is a clear decline in the total budget for the 30% category in agriculture. Now, that is definitely a matter of concern, given that all of the data sets clearly point to a large number of women engaged in agriculture. We have the NSSO data, we have the census data, all of which is actually pointing towards engagement of women in agriculture. But over the years, and again, like Renu said, some of these areas of critique simply continue to be matters of concern for us year after year, where we do not see very substantive allocations for women in agriculture. So while we see that there is mention of a number of things in the budget speech of the finance minister, where she talks about natural farming, where she mentions how a transition is required to move towards natural farming. We do not see allocations for natural farming in either the agricultural budget, or there is absolutely nothing that we see in the gender budget as well. As Vibhuti mentioned, in fact, much of the gender budget statement actually comprises of four significant schemes when we're looking at the two urban schemes of Pradhan Mantri Awas Yojana and in the rural sector, the National Rural Livelihood Mission and MNREG. Of course, again, here the allocations are not as we would have liked to see, but these four schemes actually comprise 39% of Part B. So this is where one of the major sort of concerns that MAKAAM has constantly sort of expressed is that when we are looking at women's participation in agriculture, why do the budgets not reflect that at all? In fact, just going back a little to the economic survey and the kind of issues that the economic survey had actually highlighted, the focus of the economic survey in agriculture was talking about crop diversification, was talking about natural farming, was also looking at livestock and fisheries sector, which in fact had contributed significantly to the economy. But none of this actually gets any mention in the budget, not any clear allocation that we see here. So crop diversification was also in fact brought in as a measure for moving away from the water intensive and commercial agriculture, which in a way presents a paradigm or chemical intensive paradigm, which in fact is benefiting the large corporate sector. But again, we see nothing in terms of allocations in any of these areas, no significant allocations. The finance minister actually spoke about MSP and how the government has made great strides. But if you actually look at some of the schemes, particularly the price stabilization scheme, there is actually a cut in that allocation as well. So I think, all of this, if we were to look at it from a feminist perspective, from a gender perspective, I think the models that particularly organizations like MAKAAM are trying to speak about was the first issue is about recognition and voice to women farmers, where unequal access to resources is something where MAKAAM has been talking about, very serious allocations that need to be made. But we do not see any allocations for addressing some of the structural issues in agriculture, and among them, the inequalities in access to resources, land, water resources, but also access to credit. I think it's very important to point here that women's account or women as account holders has actually increased over the years. In fact, 31% of all the individual bank accounts are of women. And Pallavi Chauhan's article, in fact, points this out very sharply, that although women are contributing in terms of deposits, the credit that is available to them is abysmal. So I think this is where we need very focused attention, even in terms of what has come by way of budget allocations for agricultural financing, where we need to have targeted focus on women's access to credit. In fact, as per the Census of India, where only 26% of female cultivators had any access to direct agricultural credit. Now, this again is a matter of serious concern, where we are still struggling with very, very basic issues of non-access to issues of to resources, to means of production, where women are completely excluded and out of the net. Now, how can a transformative sort of budget really bring in these issues to the center stage? This also calls for a reform or a restructuring of policies in agriculture, which are in fact completely silent on gender issues. I mean, if we are looking at 86% of our agriculture, where smallholders are dominant, women are engaged in agriculture increasingly, as the economic survey in fact pointed out, that more than 60% of the small and marginal farmers in fact are depending on their incomes from wages and not really agriculture. I think these are matters of concern, and the entire agriculture budget is completely silent on this. So the precarity of work and the fact that climate change and other numerous uncertainties that are associated with agriculture really are not addressed in this budget. It has been rather completely silent, despite the movement that we saw over a period of 1 year, where farmers were at the forefront, we really do not see very much coming into the budgetary allocations. Just finally, in terms of, what kind of recommendations, because we believe that this entire agrarian crisis, the model and the paradigm that it is pursuing, is very, very it's a gendered crisis, and unless we are able to address questions of equitable access, also sort of already I think the recommendations have come from Jashodhara in terms of how we want our decentralized markets, investments in the public distribution systems, and of course millets as very central to our farming economy. I think those are certainly some of the important recommendations. But for some of the immediate recommendations that we have, where we think that both policies and budgets really need to pay attention to, is the whole question of recognition through registration of women workers. We need data. There is no disaggregated data. We need resources that can actually feed into improving and advancing women's rights over land, water, forests. They need to be represented on all the programs. Unfortunately, all of agriculture is designed around ownership to land and other resources. Now, unless that changes significantly, I do not think that we would be headed anywhere. PM Kisan and all the direct cash transfer schemes are also unfortunately excluding women because land ownership is not in the name of women. So I think, I mean, if there is time, of course, towards the end, there are certain very, definite demands that have come up from MAKAAM in terms of how we operationalize the definition of farmer, just so that a large section of women from rural India could benefit from allocations in agriculture and the various programs that are part of the agriculture program. So I'll stop here, Vibhuti, and
for a very, very insightful and comprehensive profiling of agrarian scenario and contextualizing women's concerns in that, women farmers' concern. But I want to ask, what is your opinion about digitalization in agriculture? Will it have enabling effect, or it will be again bypass women, or it would be exclusionary of women farmers' interest?
Yeah, sorry. No, I think everyone has already pointed out, the question of digital divide. And this is, in fact, this is an experience that we've sort of gained over the last 2 years during the pandemic, of how women have actually struggled to just be able to have access to the devices, but also to, access to internet and other services. So I think enabling through digitalization, there are matters of serious concern there. In fact, one of the things that I did not point out, which was quite alarming, was this whole thing of introducing Kisan drones. Now, thankfully, we haven't seen any budgetary allocations which are specifically for that. But I think digitalization, which also takes you in terms of, data and land records, can be a matter of serious concern. And that is, something that the way the whole infrastructure and digitization thrust that we see in the budget is worrying from that point of view. It is not really giving or empowering people with digitalization, but it's actually helping a very proactive role of the state to actually help
surveillance
system. Yes,
surveillance.
Surveillance and corporatization. Yeah.
But management institutions are coming up with several working papers saying that it is a solution to corruption. No? So to what extent does it do? But I think our experience, can you just tell us, does it curtail corruption?
I don't think that would be the case, because I think we've seen different ways of bypassing the digitalized systems also. And how much has it really prevented corruption is, maybe some other panelists could throw some light on that. But as far as we see in terms of digital access, the major barrier is going to be the digital divide. And that is true across the board in terms of even access that women have to banks. The fact that they are not even able to access banks for credit is something that I think really is a matter of concern.
Now, thank you, Seema. Now, I would like to ask Dr. Manimekalai. Hello, Professor Manimekalai.
Yes,
Yes.
I'm there.
My question to you is that has the union budget taken any steps in direction of providing social protection and social security to women in informal sector, especially the migrant workers? And does it address the demands of transgender communities in terms of education, housing, employment, and health needs, which government of Tamil Nadu has been doing for quite some time? So how do you see these two issues?
Yeah. So thank you very much for this opportunity, and my fellow panelists, Ravi and Vibhuti. There were a lot of discussion, and particularly about social protection. It's already been enough told, but still I'll focus on certain areas. Before that, I would like to, because that not much discussed about this. So the female work participation rate, that is what Professor Vibhuti also asked me to. So that 2 points, I'm not even sharing my slides because already everything has been covered.
No, you can share it. It will be useful because the data on.
No, I'm only talking about these two concepts. So that is why I'm not.
No. You can make your.
Okay.
Yeah, you can highlight.
So this about the female work participation, oh, it's already there. Okay. Because why I didn't ask Arjun, because I'm going to only discuss the female work participation. Can you come down? And then I'll go to the no, further down. Yeah. These are all things already Soda and the others discuss. Yeah, this is one. So as far as this female work participation, this is a very critical issue, and this has been happening for 2.5 decades or so, whether it is rural or urban. But not much could be found there in the budget. Like it is saying that 60 million jobs, but I wonder how it will be, whether through this infrastructure, which has already been said, whether it is going to happen in that or any other. And there is no specific provisions to time this also. So that is why it is one. I'm wondering how it will be achieved as far as to address the question of this declining female labor force participation. Particularly, as he pointed out, it is 92% in the informal sector. What is the kind of provisions this budget has made them? It is so totally silent over that. That is what I would say. And some of the, as Ravi pointed out, there has been a decline also, reduction in the provisions also. So let me come to this work participation rate. The decline has been from 26% to 20%, and now further down to the urban area, it is 18%. And there is a kind of a desperation, particularly during the pandemic. And I myself engaged with the working population, be it construction workers or street vendors or domestic workers, because during the pandemic we captured to their needs also. So now there was a little revival. They started going, but still again kind of some issue. So there has been, particularly in the pandemic context, it has worsened their condition, and there is a desperation. As you could have watched that in UP and Bihar, there has been protest because 40,000 vacancies could not be filled. And it is the phenomenon pre-pandemic too, but it has got worse during this pandemic. And the other most important aspect is that they were forced to move to casual labor. That is very important, because it is happening even in the formal sector. Like take education. In the education, you have the hourly basis teacher or self-financing teachers. They are almost treated as casual labor. They will come for that hours and take only a paltry. And even if they are self-financing guest lecturers, they'll be there for the whole day and a very minimum amount. So I'm talking about even in the formal sector, the informalization is taking place, and the other, the very informal sectors are not the exception. And I do have the EPLFS data also but still how unemployment has been on the increase from 10.5% to 11. Can you go to the next, Dr. Arjun? And this the CME data also further says that there has been a shrinking labor force participation, and the data has been given. So the issue is, as it was even raised with Seema, that the gender divide. So on the one hand, you are focusing on capital expenditure to the tune of 35% increase, and you have also spelled out 7 engines, and we only expect that they are going to create employment. But will these women we are talking about, that is 92% in informal sector, will they be suiting to the kind of the employment generated in this infrastructure development? That is the question, because this will be mostly capital intensive, and will be technology based, and the labor intensity is very much required for this, as Ravi pointed out, but it is not going to happen. Next slide. And this digital divide is going to have, because 21% of this. Can you go further down? One more. All this I have already told. Yeah. This is again in the pandemic, the unpaid care, there is lack of mobility because during the lockdown it was, and of course transport. So all these issues, and I have some minimum input on the how many hours they put in, and how it is the shadow pandemic, we call it as, where people were overburdened with both the household work as well as the work from home. That is at least for the people who were able to get such opportunity, but others were suffering. And so there are gender issues that women spend 5 hours in unpaid work compared to men, that is only 1.5 hours. And when they go out also, they use public transport. And now the public transport services, of course, thanks to government of Tamil Nadu, that they have introduced free public transport. So people now, even I was talking about the construction workers, they are taking 2 city buses so that the bus will totally be free. There are issues like that conductors and drivers are not making these women enter. The moment they see the women, they are not. That issues are there that are being discussed, but at least that welfare measure is there. Next slide. This is the one which, next, Arjun. So what I feel is that I was talking about this declining labor force participation and the kind of budget allocations here, that is towards capital expenditure. So I fully agree with Ravi that the capital expenditure has been happening at the expense of the social sector, reduction in the social sector expenses. So there is no positive direction for women employment, nor any acknowledgement of their employment crisis, though the finance minister is expressing the concern that there has been an issue and women are suffering, etc., etc. And I already told the preferences towards capital investment. And one example I can give, for example, this infrastructure is going to be implemented, the infrastructure project. One industry is the construction industry. One example I'm saying. So in the construction industry, whatever the kind of the advanced technology that they are going to use will be, the laborers will be drawn from the very organized sector. I mean, within this informal sector also, you have an organized contractors, etc. So these women who are not equipped with such large construction sites related work will totally be excluded. And only when there are only a small construction, they will be able to go. So this is one way in which you can look at how these large infrastructure projects where huge allocation has been made won't be helping these informal sector workers at all. That is one thing. And of course, even the digitalization, again, in terms of the one class, one TV channel initiative, I'm afraid whether there will be allocations or this allocation will be converted or to employ, because you need more teachers. There are a lot of vacancies that has not been covered. So there is, again, even in these sectors, employment is a question. Next. Arjun? Yeah. So another important area is self-employment, connected with the employment, self-employment, and there are some schemes like emergency credit guarantee scheme. But what is actually required is, of course, I don't deny that this scheme is required and they are going to extend till next March. But what is required is that I can, because I have been with women entrepreneurs for a long, leave alone the general entrepreneurs. Women entrepreneurs are really struggling. And in my own experience, because I directly work with the women entrepreneurs, I saw them shutting their units. Several, at least 100 and odd units in my own city, who have been engaged in mostly related to food processing, catering, hospitality, etc., etc. They had to either totally, because food processing related to catering or other things, the demand has totally gone down, and over the period for 6 months together, 1 year together, they could not perform well, and therefore they had to shut, and some of them joined the wage work, and the members of the family also who were engaged in this had to leave this. And this is the hard. And when they go and approach the bank also, it is not that easy. People simply say that banks are open and Mudra scheme and other schemes are there, but these schemes are really not capturing to the needs of these, as Professor Vibhuti pointed out, is nano, not even micro enterprises. So these enterprises, they require very, very minimum support, but even that is not given, particularly when a women approach. This stereotype continues with the bankers, and they don't see women as the agency of women is not recognized. So what I feel here is that of course you have the schemes, whether it is credit guarantee scheme or emergency, and there's a ECLGS scheme. Apart from that, you also concentrate on the real needs of these self-employed and micro entrepreneurs, and particularly women entrepreneurs, and marketing of their products, whether it is self-help group women or these micro entrepreneurs. They are not able to compete with the large corporates. Every streets they were doing the business, but now it is all occupied by the Reliance and others. And so their plight is that they are not able to be competent, and therefore what is required is not just the credit guarantee, but also you have to find ways to provide them the marketing support, or facilitate their market, or devise strategies as to how. Number of, in Tamil Nadu it is happening, number of departments, they reserve the products for these women entrepreneurs or the small scale and micro enterprises. And there is a requirement of convergence of various line department, whether it is rural development or women development or health, where number of requirement is there. If it is a midday meal scheme also. So these people are engaged in those products, and therefore you try to tie up for the marketing. So these kind of arrangement only will be required, and the budget doesn't talk anything about on these issues. They are very, very important issues that is very much present with a very vulnerable group. Next, I think these are the major issues. And as far as the social protection and other can you go down further? Yeah, what is the actual contribution of this further down? Something which Vibhuti asked about social protection. Yeah, further down. These are things already dealt with. Further. Yeah, this is of course a decline. It will obviously show the decline. Next. Yeah, here you also told already. Next. Yeah, this is what you are asking, no? So there are 3-4 major aspects. No, next. next. Yeah, this protection schemes. Already, I think our fellow panelists discussed about all this. But 1 or 2 points I can just so regarding this ICDS. Or the scheme, midday meal scheme, I can say that from Tamil Nadu, we can draw an example. Even recently, Government of Tamil Nadu announced that the midday meal scheme related grains, pulses, including egg, will be supplied at the doorstep for 15 days together. Like every fortnight, they will supply. So this is a kind of arrangement they have done. And what I wanted to also suggest is about the workers, the unorganized sector workers. For example, fisher women, they go in the middle of the night, like they go to the coastal belt, get the fish catch. You know that majority of the women vendors are the women only, fish vendors. So they go in the night. It was even suggested there in Kerala that they don't have any protection at all. They have to go in the night around 3 o'clock or 2 o'clock, and so that the fresh fish catch will be there, and they buy and come. And there is literally no transport on those times, nor any shelters too, because they have to wait till the fish catch come. So 3-4 hours they have to wait, and so there's no sanitation facilities, no shelter, or back there is no transport. Of course, in Tamil Nadu, for vegetable vending, you have the farmers market called Farmers Sandys. For that, the government is providing free transport from different villages. There even transport and bring it to the market. That is not the general market, but it is farmers market, and mostly it is occupied by the unfortunately the men and the local vendors, but some of the women are there. So these street vendors and other categories in other states, I don't know what is the arrangement, they really don't have a proper transport. Particularly they start very early in the morning, so that should be provided. And there are a number of other the Beti Bacho Beti Padho scheme also. I don't know, it is not I mean the allocation is not increased, and I'm afraid how declining sex ratio is really bothering. And Tamil Nadu recently, with an NFHS data, it has gone down to 893. It was early 954. I am afraid whether this must be happening in other states also. So given this declining sex ratio and other such challenges that is existing, a cut in the social sector and on all these schemes would definitely have a say over further penalizing these women who are already suffering, and they triply suffered in the pandemic, and therefore it is difficult to realize. And what this capital expenditure is actually going to say, for whom this capital expenditure, that is very, very obvious that it will be towards these corporates. And even digital, Seema, I mean, Vibhuti was asking about digitalization of payment, and it will reduce corruption. So I have been listening to, or at least getting inputs from others, that even the university system, you have the gem purchase. So I thought, okay, it is highly transparent, but it was told that there will be hidden arrangements of corruption. It is even there will be some kind of understanding. So I don't think that the digital payment will be transparent and reduce corruption. We only wish that it should be, but unfortunately it is not happening, is one thing I would like to say. And the other one is about the PM portion, that there has been it has been definitely helping, but I think they are going to stop because they have either it is remaining stagnant, I believe. So we have to really lobby for that it should be, because given and the kind of the vulnerable group, whether migrant workers or the trans people, or Vibhuti was also asking about trans. The trans people were trans and the sex workers. They were the other vulnerable during this pandemic, and the people were not even overextending support from the public, the civil society. They least bothered about these people, and therefore in the I mean, Tamil Nadu has been very, very progressive in terms of accommodating the needs of the trans population, but still there has been gap. And I've been listening to the stories of the trans people who are sharing their issues, that the very political parties will come and encourage these trans to start enterprises. But the very next day, that will be through gundas, they will be demolishing. So this kind of thing. So because there is a perception that from the public itself that they only fit for sex work, and therefore even if you allow them to start an enterprise amidst the general mainstream population, it may not, they may not be doing the business, but rather doing sex work. So this kind of perception has got deep-rooted into the minds of the general population, and therefore they don't allow them. And even with me, one of the PhD scholars joined. He's a male, but he's a trans person. He came here as trans, a male only. Now I am taking all efforts that he can go for whatever requirement and got his gender changed there in the gazette, and we can accommodate. But his insecurity is that even if I join like this, after my completion of PhD, whether as trans I'll be getting employment. So these are all the kind of issues which are hidden. And yesterday also we had a discussion with trans, a lot of federating themselves, a lot of issues them being handled, and they are representing. And we have in our planning commission itself a trans person representing. So some such progressive steps, and Kerala is also equally doing well with the trans women, trans persons policy, etc. So let us see these vulnerable, over whether migrant workers or homeless, trans persons, sex workers, a lot of other vulnerable communities, they be accommodated, and there are quite a good state models, and that could be replicated by the central government also. And that has been happening even in the maternity benefit distribution of fund. They have taken the model from Tamil Nadu, and several other states must also be progressively doing that. So wherever it is possible, it is necessary to adopt it. Next, let me see whether any other. No. Yeah, this is what I wanted to really, and go with some recommendations and stuff. Who will benefit by capital expenditures? There has been an increase of 34.5%, very huge, and whether they are going to be female employment generating, that is the question, and that too the informal sector, which I have already told. And second is about the quality of jobs. One is about the very job itself, the job creation, whether this budget has really got that in mind, and this 6 million jobs be really be quality also, because I already told that women are facing the deplorable conditions, casual work, and even MNRGA for that matter. There has been issues that even in Tamil Nadu, it says 100 days of employment, but only 50 days of the work or 60 days of the work is being done, and that is also being redistributed to others. Sometimes it is when it is closing, then they will call and give all people the work. Otherwise, they will have always the preference, and of course, it is feminization, I should say. Feminization of labor is taking place in the positive sense. More women are being, but unfortunately, the nature of casual work is on the increase, and therefore the quality of the work is also important to be concentrated upon. So if we keep on saying digitalization in every field, whether women will be included in that, that is a question. On the one hand, you are talking about inclusive growth, development, etc. On the other hand, the kind of arrangements, I don't say that the women will not equip themselves. They will equip themselves, but you have to give a time. If for the moment, if you keep saying, even in agriculture also, see if it is digitalization of the classes, unless otherwise you provide access to the devices, access to electricity, where is the question of providing those? But so much has been allocated for that. So I think these are the practical issues we have to understand before, whatever has been allocated should also go and spent in those lines, so that something could be realized proper. And so on the whole, it sees that the very focus of capital expenditure or infrastructure projects or digitalization, all these in a way convey very obviously, not even very, it is very intrinsically or whatever, it's not very obviously convey that is going to definitely encourage more corporatization. I agree with Sanghamitra that there are some positive developments. But still, the way in which it will be implemented, how will it be implemented, whether it will be capturing the needs of the vulnerable, that is the question which is very important. Next, I think that the last slide.
Now I think, yeah, you'll have to sum up.
Yeah.
MSME sector. Yeah.
I think I have already touched upon.
Already told.
So the financial stimulus is there, and though that stimulus should actually give an ecosystem for the entrepreneurs to further move on the vulnerable stage to the next stage. So that is very important. And here again, the huge digital divide, which will exclude the women. And I think last slide where I am summing up. Next. Yeah. So what is required is that women's perspective is lacking, whether it is the PDS special allocation for food service, which has been declined. I don't know. In this context, you can afford to even keep the same, but you have reduced. So that is, I think somebody said it is a criminal offense. So that has to be taken care of. And so PDS should be expanded and universalized, as somebody pointed out. And people who are vulnerable in Tamil Nadu and also in Kerala, that even if you don't have PDS cards, the provisions were supplied. And the kind of the pandemic time compensation, etc., etc. So you have to first take care of issuing the PDS card to everyone, and also bring it to the brackets of receiving that. And you also know the paid unpaid work, how whether employed women or in unpaid work, everything is shared by the women. Therefore, in Tamil Nadu again, there is a provision that ₹1,000 will be paid to all the homemakers, and Goa is already doing it, ₹2,000, and I think Delhi is also. So it is the first time that the unpaid work care work has been recognized, and women, and so those provisions would have been there and should have been appreciated much. But in the name of not going very populist, and also given the elections, I think government hasn't gone for that. But those are the very immediate attention paying areas which hasn't been found, and it is required very much, particularly recognizing the work. And so the entire budget implies that it is kind of a gendered budget without taking into account the kind of pressing issues that is prevailing. And the whole budget allocations have been very silent over the SIG movement, which just got weakened, and several of them got dismantled because they are not able to actually function. Every month you have to contribute. So now they are also devoid of even at least that particular facility was available. They are not able to do it.
And also the budget strengthens the private microfinance institutions rather than SHGs. No, so that over the several budgets it has happened. So that has also been, yeah.
Okay, I could not get you. You're saying something.
I said that private microfinance institutions have been strengthened by the union budget rather
than that SHGs. Is, and how they treat these women is again, there are a lot of stories.
Okay. So now
I could. Thank you.
Thank you to Professor Manimekalai for bringing out the whole questions of women in world of work and profiling their predicament. So I think the important inferences of this panel discussion are that, number one, budget is totally silent on the concerns of social protection. The way we understand social protection as policies and programs designed to reduce poverty and vulnerability by promoting efficient labor markets, diminishing people's exposure to risk, and enhancing their capacity to protect themselves against hazards and interruption in loss of income, and the way it has happened during pandemic. The sufferers are and will be poor, informal sector worker, farmers, forest dwellers, sexual minorities, sex workers, persons with disabilities, and all other and all the underserved categories of women and girls. So the cruel fiscal policy that levies minimum corporate tax but doesn't allow fiscal expansion for increasing purchasing power of the masses, even after knowing the private investment is unresponsive to tax concession. And the second very important issue, I think, which needs emphasis, that skyrocketing inflation in essential goods for day-to-day survival of common masses have put curb on nutritious diet, education, access to education, access to health, clean and safe fuel, and hike in price of the gas cylinder and diesel fuels that has also caused tremendous human misery. Women in informal sector and other deprived sections in the rural areas are reporting that new normal is never going to be normal, as all the 5 panelists have told us. PM Kisan Yojana is limited only to landowning class, and only 8% of women who have land titles in their name. Job days under MG Narega, which is a lifeline for the BPL population, have fallen with reduction in the fund allocation, which was last year like over 1,11,000 crore, and which is now reduced to 73,000 crores. FM did not even mention this scheme in her budget speech this year. So former governor of RBI, Dr. Subbarao, stated that the budget is great on growth, but not on jobs. Social expenditure on PDS is highly inadequate, reduced to 1,45,920 crores, which was earlier 2,10,929 crores. And this is a deplorable, as the worst impact of last 2 years of pandemic is mass hunger and malnutrition. The last one is that majority of Indian population is reeling under debt, pawning assets. Studies by Asha Hans and several studies, rapid assessment studies are showing that people are just selling off everything, starting from gold and land and house and other assets they have in their homes. So women are at the bottom of poverty pyramid, and health and education costs have really shot up exponentially, and that's why women are the losers. So how will our children and young adults get solid fundamental education when the public expenditure on education is around just 3%, while the National Education Policy has recommended 6%, and right from the Kothari Commission 1960s, like there has been a recommendation for 6% of GDP should go, and currently because of massive online education, I think we need far more. The experts are saying that 8% of GDP should go for education, but budget doesn't address this issue. Another very important thing is that the union budget, which facilitates state capitalism, is in a race to subsidize super rich. The whole social sector and gender responsive budgeting has taken a backseat. It doesn't address the question of rising inequality, as Dr. Jashodra, Renu Khanna, and Seema, they have very strongly given the arguments as well as given the evidences. 84% of families in the country have faced decline in their income since the start of pandemic, and they are from SC, ST, minorities, sexual minorities, scheme workers, farmers, women from the underserved sections of economy. They feel and all of them feel discriminated against. Minorities, communities have also come up with their statement that how the budget is discriminatory. So it is in this context that women's rights organizations have vociferously demanded to safeguard the constitutional right to life with dignity. It is imperative that government must address malnutrition and anemia by strengthening, universalizing PDS, guaranteeing and provision for all essential commodities, and budget should create massive opportunities for women's work and a safe and secure work environment and for making substantial public sector investment for health and education. So now I would like to Ravi to comment, and also all the panelists to give their final concluding remarks.
Yeah, thanks, Vibhuti, for summing that up. There's not much to add, except that, I mean, given that the budget this year, the finance minister kind of spoke so loudly about our great growth rate of 9.2% last year and 8.5% projected this year. But then why are these funds not generating the resources to support the social sector? And instead going to support capital expenditures, which would ultimately get translated into PPP projects, or worse still, just private sector projects getting these subsidies from the government to make profits. Finally, what I would like to kind of conclude, I mean, from the discussions that have happened, as well as I think these are some issues that had come up in an earlier consultation of the feminist collective last month, which was a kind of pre-budget consultation to understand gender budget issues. So I think the first thing is that gender budgets should be constructed by undertaking gender audits. And here the role of the CAG becomes important, and the CAG has shown willingness to do this. So unless you do audit of all the programs, you're not going to come up with a kind of a gender just allocation. So this is, I think, the fundamental basis on which the gender budget statement should be constructed. So, and we need, of course, for this, we would need gender disaggregated data, which is very weak in this country. And Jashodra also pointed out that the need for, and now there's a tendency to kind of put a lot of programs under umbrellas, and which actually masks the detailed assessment that we could make of each of these programs. So I think this is a trend that we need to be wary of and protest against it. And then also, especially for the service delivery programs, which are there under the different ministry, whether it's health or education or women and child development, etc. All these development, these service delivery programs must be benchmarked for allocation. The budgets should be benchmarked based on what is the expected outcome. So if you're going to, you're expecting that there would be 2 crore deliveries in a year, then your maternity benefit budget should allocate on the basis of that. Or so many immunizations are going to be done, then this is what is required. And we've seen during the pandemic, there's been a huge decline in use of many of these services. I mean, their own data shows that, but unfortunately, for the last 6 to 9 months, the HMIS data has gone off. I mean, you don't get access to it. I don't know whether it's they have server issues or they're not updating it, but we don't have for 21-22 the HMIS data as yet. I mean, I tried multiple times before this workshop, before this webinar, to try and get some data from there, but it is not available. So, and finally, I think it's also important that gender should not be like, we look at the gender budget statement. In fact, there's a question also, somebody asking, what is this 30%? See, gender is not about women-specific programs. I mean, it is much more than that. And I think we need a gender lens for the entire budget. So where health is concerned, gender is not about only maternity care or antenatal care or other women-specific programs. It's also about malaria and tuberculosis and other health issues which with both men and women face. So where is the gender justice in that? I mean, does the budget reflect that gender justice? I think that is what we need to kind of highlight in terms of strengthening the gender budget statement. So back to any of the panelists wants to add something last?
Dr. Sanghamitra Dhar wants to add 3 points.
Yeah, sorry, just 3 simple points coming from my background of working directly with numerous government departments in the federal system. I would say that everyone has to understand the multi-stakeholder roles each one plays in the overall gender budget conversation in the country, from the decentralized governance system to the CSOs and academicians to the government officials also. Because civil society has a very critical part to play, and their contribution is kind of very much important and required during the pre-budget discussions. And in that, if their recommendations are kind of put in very clear, simple terms for the officials to understand how it has to be incorporated in the respective departmental gender plans, then it becomes more doable for them also. Plus, as everyone has pointed out, the sex disaggregated data collection mechanism is missing, we know that, but how to enable to work around it is very critical, and handholding the states on that is very vital. So for instance, we in my current program, I am helping the state in building that format wherein the beneficiary or the non-beneficiary schemes are tabulated and understood what is the division of the segregation in the overall sector per se, because schemes are only part of it. Overall sector is also very, very important. So these 3-4 points as a civil society, if they are able to contribute to these officials, because primarily that is built by them, and if they are not aware of how it has to be done, and that is where the civil society plays a very critical role in my understanding. So if whatever we have spoken about can be put down in simple, doable terms and then disseminated to these officials, they can pick up many of the suggestions and recommendations, as we are seeing in many states that we are working with. So this is a simple suggestion and a recommendation. Thank you. Thank you for the opportunity.
Yeah. Anyone else? Seema, Manimekalai, you want to say anything?
I mean, I think much has been said, but I think for the agriculture sector,
Yes.
I think, the fact that women as farmers are completely invisible, I think that is where the major problem is, that you do not recognize them as workers, as farmers, and there is no policy for women farmers. In fact, NCW had proposed a draft policy, but that never, saw the light of the day. So I think that is going to be extremely critical. What are the ways in which we can formulate policies, articulate the questions of women as farmers and workers? I think that will actually lay the foundation for what kind of transformative financing would then become possible. So I think I just wanted to add that one point.
Professor Manimekalai?
Yes. Yeah, 2-3 points, I think. I add with what Seema was telling, that the introduction of drone, they are going to. So that is going to really have implications on the labor. Already you're suffering. And really endorse the view that women farmers, it's high time that the women should be recognized as farmers. And I'm concerned with the much neglected areas, though it's very much in significant terms of employment, etc. The informal sector, contributing to 35% output, 45% export, 90% employment, etc. But still not sufficient attention has been given, and not much here in the budget. So that is one area where it has to be exclusively concentrated on. And the other one is gender inclusive focus. It is the whole the gender spectrum and the specific hardships of each gender towards inclusion should be taken care of, and accordingly policies should be there, and the gender budgeting should also be having focus on that. So these are the three, and the fiscal deficit has been focused in this budget. So social sector has been totally neglected. So that has to be focused. It is equally required. Like, you have to cut down your fiscal deficit. At the same time, it cannot be at the expense of the very vulnerable areas where it is supposed to be. So,
and with you, I would like to add about women migrants also. There are 3 crore women who are migrant workers, and they are also, in the whole discourse is male-centered. There is a totally masculine discourse. Thank you very much. Now, IMPRI team, please take over. Yeah.
Thank you, everyone, for such an enriching deliberation, almost supper time. So to propose the formal vote of thanks, now I invite Khwaish.
As we come to an end of this discussion, extremely enlightening discussion, I, Khwaish Qadian, researcher at IMPRI, Impact and Policy Research Institute, New Delhi, would like to formally propose a vote of thanks. We are grateful to Professor Vibhuti Patel and Ravi Duggal for taking out the time for being with us and chairing such a thought-provoking talk on gender and union budget 2022-2023. Thank you. We thank our discussants, Professor N. Manimekalai, Ms. Seema Kulkarni, Dr. Sanghamitra Dhar, Ms. Renu Khanna, and Ms. Jashodhara Dasgupta for adding their diverse perspectives and valuable insights to the deliberation. And of course, we thank all our participants who are here on Zoom or on Facebook Live for participating and raising their pertinent questions. We are also grateful if you're watching us later on YouTube or listening to us on our podcast. Thank you again, and I hope that you continue to tune in on future episodes of the State of Gender Equality #GenderGap series, as well as other lined up deliberations on Budget 2022 and IMPRI Web Policy Talks. Thank you and have a good night.
Thank you, everyone.
Thank you. Thank you, Ravi. Thank you, Vibhuti, and all my friends.
Yeah.
Thank you.
You made it.
Thank
Have a
you.
good night.
Thank
Yeah.
you.
Thanks, and bye. Yeah.
Thanks.